Hi, this is Maureen O'Hara. I'm going to pick up with these admission order forms that I started with for the ortho service. So you've ordered something PO, you're going to order something IM, and here are some consults that you might order. Patients with loose teeth need to have a dental consult. Anesthesia is very insistent on that. So if medicine has not ordered that, if you could please do that. Please order a vascular consult if the patient has gangrene or questionable pulses, or if you order any vascular studies. Dr. Chambers likes there to be a note on the chart for what level is going to heal. And then put in the date and the time, and you sign it and put in your dictation number. That's page 1. Put a patient sticker here. Then on page 2, you can order all these things. Generally speaking, we leave the workup of the patient to medicine. And I wanted to point out that at Rancho, stat really does mean stat. And if you order something stat, you need to hand the chart to the nurse, because that means it has to be carried out within 15 minutes. If you want things to be done quickly, choose ASAP and then still let the nurse know that you've done that. The nurses are very good at Rancho, and they will accommodate you, and if you approach them in a nice manner, they will go out of their way to help you. Some of the things we can order here are x-rays, which radiology requests that you order if one has not already been ordered, and the transcutaneous oxygen pressure, the TCPO2, and the arterial Doppler, which is what vascular prefers. For the weight-bearing status, usually weight-bearing is tolerated as sufficient for most patients. Try not to order physical therapy unless there is a specific problem that you want physical therapy to address, because everybody gets physical therapy post-op. For the dressing change, usually somebody has ordered that, but maybe you want it to be something else. So we can have dry dressings, normal saline dressings, Silvadene. The wet to moist can be acetic acid or normal saline. This is my way of trying to solve a systems problem. We don't want the nurses to tape down the Kerlix. We want them to use the burn net instead. And as I tell the nurses, you need to use a foot for a foot. You need to have at least enough Kerlix to cover the dressing, or what happens is the Kerlix just rolls up and the burn net just rolls up and comes off, and then that doesn't hold the Kerlix down. For the wet to moist, please check this off. Otherwise, what happens is the nurses take a wet 4x4 and just slap it on the wound, and that way the good tissue gets macerated. We want them to call us if the patients have pain issues. We want them to call medicine if they've got medical issues. If they're in somewhere else besides the 900 building, we can ask that the patient be moved when a bed is available. And then this is also my idea of trying to solve a systems problem. Check this off, asking that they block the schedule in Affinity so that the patients are in bed when we have our rounds. Here are some labs that you can order, like if you're ordering from clinic, for example. Please do take a wound culture. We do this as a courtesy. It may have already been done. If it's not done, please order aerobic, anaerobic, and MRSA. That means you need 2 reds and a blue culturette. If you just do the MRSA screen, that's all you're going to get. And I know that Dr. Holtum doesn't recommend this, but it does give medicine a direction for the culture. So I'm going to stop here, and I'll pick up with the rest of the orders in my next segment.